Good morning, everybody, and welcome to day 3 and 4 of our 28 days of National Smile Month. I'm doing a double bubble today because someone's asked me 2 questions, but they're kind of interlinked. So the first question was, why do my gums bleed? And one of the big enemies that we have in our mouths is something called plaque or plaque, depending where you live. And it's just a mass of germs, all held together by this really sticky substance called biofilm. And they're alive. And to give you an idea, there's about 3 million in a pinhead. So it's really concentrated stuff. And because they're alive, they gobble up food, have a few million babies, and then they go to the toilet in your mouth, which is really lovely. And it's those poisons that the gum germs produce that irritate your gum. Now, bodies are brilliant at looking after themselves. So what they do is your gum sends a message out to say, help me, I'm being invaded. So your lovely body rushes extra blood into your gums to try and sort things out. So it's because people are leaving plaque that they get the bleeding. And your gum's big and fat, of extra blood. And so when you come along and you brush, or sometimes even just sleeping on a pillow is enough to, make things bleed. So the other question is, what's gum disease? Well, actually, that early bleeding when you're brushing, that's the very first stages of gum disease. And if that's not, corrected, and if people don't get their cleaning techniques right, and it goes on for years, what happens is that those plaque poisons start creating little pockets between the tooth and the gum. And then once they get deeper, they then start to literally eat away the bone surrounding the teeth. So long term in gum disease, what happens is people find they have wobbly teeth. And it's literally where, everything just isn't held very tightly. If you are worried about bleeding gums or worried about wobbly teeth, then, ask your dentist or your hygienist and they'll explain to you. If anybody wants to ask me any other questions, leave a comment below and we can answer the questions on another day. But guys, just really good cleaning will help gum disease. Okay, take care. See you tomorrow. Bye.